Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Keith Hoerth is the Vice President for Laboratory Services at Kaleida Health. Keith, thanks for joining us today.
Thank you for having me.
There's been an awful lot of talk the last couple of weeks about the laboratories and testing and all that. But before we get into that, tell us a little bit about the division of laboratories within Kaleida Health.
So the Division of Laboratories within Kaleida Health, we have a main hub over at Flint Road, and then also lab sites at each one of our hospitals in our campus. And currently we run somewhere in the 8 to 10 million tests per year, have around 420 employees in the laboratory department, and are constantly busy with managing tests for the hospital sites, for outpatients, for surgery patients, and basically helping out the community where we can.
So why is the lab business so important to the day-to-day operations of a hospital system?
So when you look at when a provider physician is trying to make a decision, 70% of their actual clinical decisions are based off of the lab tests that they're getting back. A lot of times they have an idea, but they really need that lab test to give them the final picture or to help them with the diagnosis. So we are part of 70% of all clinical decisions that are out there. We also make up a huge amount of the medical record for a patient. So we are part of the patient's history. We follow them along and basically are a key for providers to know what direction to take.
So I think providers would recognize that. Maybe the patients don't understand that as much. They don't understand that the lab division is an important part of, day-to-day hospital operations. So maybe it has been a function of being behind the scenes or kind of the unsung heroes of hospital business. But really the last couple of weeks, that's all changed with the testing capability and the capacity you guys have. Tell us where you guys stand when it comes to testing for COVID-19.
So currently right now we're running a PCR test, which is the test that's really determining, do you have the infection right now? Are you shedding the virus? Can you infect somebody else? And we've been running that test since the 22nd of March. We have approximately 200 tests a day that we're running. We can go up to probably about 400. And we are expanding on to a couple different devices and other platforms to try to get up into that 800, maybe even 1,000 test range to expand off and try to get as many of the, not just healthcare providers, but other essential workers that are out there to help out the community. Along with that, we are rolling out an antibody test. This would be the other side of the equation where not the current infection, but have you had it at some point? And do you have antibodies to this? This is going to be for the people that are really wondering, did I have this infection at some time? I had something that seemed like a cold or some minor symptoms a month ago. Was that part of this? So we're really trying to roll that out too. A lot of that's going to be helping out for just public health and awareness in the community. And that's something we're really excited about. So we have that full picture of the infection and also have you have this. And also looking at that, not a whole lot of data yet on where this is going and if that antibody is really going to be a predictor of long-term basically protection for a person. But it does seem like, at least in the data that's out there for the last 3-4 months out of Asia, that it does seem to have some protective capabilities. So we'll see where that kind of goes. But at least this is the upfront test that would be needed for that.
So you guys have obviously done pretty significant testing, not only annually, but over the years. What has changed? How has the COVID-19 pandemic changed the way that the labs operate? What's been the difference maker here?
With this one, it changed a lot of our routine aspects. So we're not running as many of the routine tests that we normally would. It really focused us into one area, concentrating on this pandemic. And it's been very interesting because it's been a partnership with other groups besides ourselves. The device that we're running this on, we are working with UB researchers because that was one of the devices that they were running research tests on. It's really been a partnership between Kaleida, University of Buffalo, and research and trying to put these pictures together so that we're providing for the community.
Tell us the makeup of the workforce. How many do you have, and what locations would they be assigned to?
When you talk about laboratory testing, people don't realize we have multiple different departments. We have chemistry, hematology, blood banking, anatomical pathology, microbiology, which is very important right now, but then also couriers and processing, phlebotomy, research areas, outreach. It's expansive. We also have our main lab hub over on Flint Road, but then also we have sites in each one of our hospitals. The sites in the hospitals are really doing the day-to-day operations of those hospitals and getting the stat tests out when you're in an emergency department or surgery, whereas the one at Flint Road is a lot of outreach and also some specialty testing.
So I guess the timing is perfect then with all the news about COVID-19 and the testing that's happening. We head into this week as Laboratory Services Week. So if you can, tell us a little bit about what that celebration means and any special messages for your workforce.
It's National Medical Lab Professionals Week. It's going to be a little different than previous ones. We had a lot of different celebrations where we brought staff together with food and games and things like that. We're not going to be able to do that this year, but it still does not mean that our lab staff is any less important. In fact, we were way more important at this point to continue on with the great work that we're doing. We have some dedicated staff that have been putting in countless hours to try to make sure we're getting these tests up and running and validated and continue them going. And without that, we would be nowhere with our testing. Our community would be in a different situation than we are right now. So very thankful for all the lab scientists that we have, thankful for the phlebotomists, the couriers, the people doing processing, the people in anatomical pathology, and the whole group has just come together to really try to work on this. And in fact, there's departments that are helping out that they might have been a little slower because we're not getting some of the outpatient stuff in. They stepped forward and said, hey, can I help set up kits and aliquot tubes and get collection materials ready? So they've really stepped up and done a fantastic job. So if you know somebody that's working in the laboratory, say thank you to them and let them know of the great job that they're doing.
So Keith, as we wrap up here, I know you said thank a lab professional, but on behalf of a grateful organization, a grateful community, thank you and your team and all those in the lab division for all that you guys have done, not only day to day for our patients, but for this pandemic at this time.
Thanks, we appreciate it.